Lessons from the VA, tonight on Call with the Prairie Doc. Funding for On Call with the Prairie Doc is provided in part by
Avera is a proud sponsor of On Call on South Dakota Public Broadcasting.
Larson Manufacturing is proud to support On Call Television as it continues to open doors for important medical information. And by the South Dakota Foundation for Medical Care, the Medicare Quality Improvement Organization for South Dakota. Additional funding is provided by Aberdeen Asthma and Allergy, Brookings Health System, Dr. Mark Bubach with Dakota Allergy and Asthma, Dakota Care, Dakota Dermatology, the Orthopedic Institute, Physicians Care Sanford Clinic Community Service Committee, and Swiftel Communications. Closed captioning for On Call with the Prairie Doc is provided by the generous support of Avera, Brookings Health System, and Fishback Financial Corporation. While the U.S. veteran population is expected to fall from 23 million in 2010 to a projected 14 million in 2040, they will always be an important part of our society and deserving of our care. The Veterans Administration is charged with overseeing that care. Lessons from the VA, when we are on call with the Prairie Doc.
Good evening and welcome to On Call with the Prairie Doc. The United States Department of Veterans Affairs, or more commonly known as the VA, is responsible for providing care to veterans and their families. Of the 23 million veterans alive today, nearly 3/4 served during a war or an official period of conflict. About 1/4 of the United States population is potentially eligible for VA benefits and services because they are veterans, family members, or survivors of veterans. Unfortunately, the VA has had some troubling publicity in recent years, stating that its resources are overburdened. A request for care may take several weeks or more, and when you go to your appointment, the wait can take hours. There's also a belief that politics have clogged the ability for the medical providers to treat individuals in need in an effective and timely manner. So tonight, we hope to address some of these stereotypes and urban myths that surround VA health care in America. I'm joined in our studio by VA expert Dr. Carrie Carlson of the VA Health Care System in Sioux Falls, and via Skype, we have Dr. Michael Davies, the Executive Director of Access and Clinical Administration Program at the U.S. Department of VA Affairs in Washington, D.C., both to discuss all aspects of veterans care. Let's start with you, Carrie. Tell us a little bit about who you are, where you're from, what got you trained and what training you had, and then how are you involved with the VA?
Great. Well, it's a pleasure to be here. I feel very honored to be here sitting with you talking about the VA. And I'm originally from the Canton area. I went to undergraduate at USD.
South Dakota kid.
Yes, I'm a South Dakota kid, absolutely. And then went to medical school down in Des Moines, Iowa, osteopathic school, family practice residency in Sioux Falls, loved family medicine, and pursued work at the VA. My father's a veteran.
Right after your training, you went right into the VA?
Nope, I worked for Avera McGreevy Clinic for 10 years and was just kind of maybe looking for a slight change and a part-time job, 2 little kids at home. And I started to work at the VA doing primary care, and it's been great. I love the VA.
You've been there for how long?
About 2 years.
Okay.
Yep.
And Mike, tell us a little bit about yourself.
So I'm a 5th generation South Dakotan, actually.
You grew up where?
I grew up in Bridgewater, born in Wagner, grew up in Bridgewater, and went to school at Brookings and Vermilion, and then did eventually a residency in Sioux Falls, actually, which introduced me to the VA, and then ended up joining the VA, actually, at the VA Black Hills at Fort Meade. Now I just got my 30-year pin, so I've actually been in the VA for 30 years, which is hard for me to believe because it seems like yesterday. So it's been a long and interesting career. I never would have guessed it would have been this exciting of a career.
So you and I were together when back in internal medicine when the ASIM and the ACP joined. That's a kind of a story about internal medicine clubs years ago, and I have really enjoyed our friendship through these years. But you're not just a doctor at Fort Meade anymore. What's happened? You've kind of left our state, even though you still live in South Dakota?
Well, I certainly haven't left the state. I mean, I'll always be a South Dakotan at heart for sure. But what happened was I started as a hospitalist actually at Fort Meade near Sturgis, and enjoyed the heck out of it. I mean, it was a great, introduction into medicine. And then I got drawn into the leadership path. So after 6 years of being a hospitalist, I spent actually 14 years as the chief of staff at the VA Black Hills, Fort Meade, Hot Springs, about 11 outlying sites of care. And then got drawn into sort of the national level big system administration. And now for the last 8 years or so, I've been working in VA central office trying to improve the whole system.
So, and have you just recently been in charge of outpatient care? Is that right?
About 8 months or maybe a year ago now, we set up an office in the VA called Access and Clinic Administration, sort of just ahead of this crisis, with a clear recognition that we needed to focus more on running these practices in the VA. The VA is huge. There's 288,000 employees. There's 1,700 sites of care. We figure there's something like 30,000 practices. So it's really an opportunity to sort of influence and improve and, set standards, if you will, for the larger organization.
So they put you in charge of access, and then right before your eyes, it exploded with some bad press. Tell us a bit about that, and then we'll get back to Carrie, but let's hear that.
Yeah, so you may have heard that, this started in Phoenix with a few people who were alleged to have died while waiting for care. And got a lot of course, that's a pretty salacious allegation, and it got a lot of press. And it got a lot of people jumping on the bandwagon saying, where else have people died waiting for the VA? And it turns out after all the dust settled, 6-8 months later, after the OIG investigated it, the Inspector General, the VA's policeman, that came in and looked at every single case carefully, concluded that the waiting for VA did not cause these veterans to die. So it was, a recognition that any waiting is bad, and that VA has to do a better job at decreasing waiting times. But at the same time, it was a bit of a relief.
And I'll only comment that if there is a major criticism that I would have about my practice all these years is that they've had to wait. I have never been very good or very timely, and it's a terrible imposition on people. What's your comment about what Mike has said? And before Carrie answers, we will answer your questions about veterans' health care as they are called in. What do you want to know about benefits, the types of treatments available, questions from Agent Orange to PTSD? Your participation is the fuel for our conversations tonight. Call in with your questions or comments. Call 1-888-376-6225 or email your questions to ask@oncalltv.org. Tell us, what's your response to what Mike said?
It was heartbreaking. I think surprising. Of course, we know that sometimes care can be delayed for various reasons, and it was sad. I felt bad that other veterans feel like their care was delayed. So.
But how long do people have to wait to see you?
To see me, a week. Maybe. I mean, I do occupational health as well at the VA and some primary care, but not more than a week usually, and we work with that.
And when you have an appointment at 10 o'clock, how much time do they have to wait before? Are you like I am? You're
I sometimes talk a little long, so sometimes I'm not timely, but I try. I try to not be more than 15 minutes over, but it depends. If someone's critically ill and they need my attention,
you give it.
I give it. Or if they have a PTSD thing they want to talk about and they haven't talked about it before, and I can tell it's a sensitive subject, I'm going to give them the time they need.
Some of the patients walk in my moccasins and understand I'm trying my level best, and sometimes it takes more time, and then you get stacked up behind and so on.
Yeah.
Some of them decide to go to another doctor because
Right.
I'm kind of late.
That's okay.
Should we talk a little bit about the fact that this is a huge practice, as Mike said,
Yes.
and that there are all these doctors and all these care providers going on, and some may be more timely, sometimes it's easier to get in, sometimes the demand is bigger than what they can provide. Don't you think the VA is an easy target to criticize?
I think so, and we are so large. I mean, Sioux Falls, in our side of the VA system, we saw over 270,000 appointments with our out-based clinics in the Sioux Falls VA in 1 year. That's a lot of appointments.
A lot of appointments. How many people are practicing at the VA?
Oh,
Physicians,
Physician,
PAs, nurse practitioners.
The primary care department I know has 14 providers. I off the top of my head, I couldn't tell you with all the specialty doctors.
All right.
But-
Mike, any other comments?
Well, Western South Dakota, has two VA hospitals, one in Fort Meade and one in Hot Springs. And then there's actually 11 sites of care. So there's 9 other community-based outpatient clinics in the catchment area. And there are a number of providers, as I recall, about 50 full-time providers, that work in the CBOCs and in the hospitals. And then we also purchase care. We buy a lot of care from the community, at Rapid City and Scotts Bluff, Nebraska, because the VA in Hot Springs serves western Nebraska. It serves the reservation, so it has one of the largest Native American populations of any VA hospital in the system. Not the largest, but one of the largest. So we have a diverse mission that includes not only healthcare, but also a social mission. There's a homeless mission, there's PTSD and mental health treatment. There's a community of veterans that have a camaraderie, I think, and we try and fuel that.
It's often said that if we were talking about who provides health care in America, and that if you take the Medicare and the Medicaid and the VA, that's 60% of the finances of all of the health care, and the rest is the insurance industry, and we all talk about the rest. But it's the national government takes care of a lot of people. Yeah. Am I right on that 60% number? I think
that's close. Yeah. There are 2 on that map you just had. There are 2 other clinics that the Sioux Falls VA helps and associates with, is in Spirit Lake, Iowa, and in Sioux City.
So what do you call those little outreach clinics? I mean, I see them in the middle of the state and all that. What?
They're called the CBOC, CBOC, or Community-Based Outpatient Clinic. And it's staffed with a provider, a nurse, a couple of nurses.
And if they're not happy, they can call Mike Davies, and he'll take care of it.
There you go.
All right. Sorry about that, Mike.
They do sometimes.
All right. Well, we'll be back coming up. Over 6 million people received care in VA healthcare facilities in 2013. 6 million. This care is not only appreciated, but vital to many of our veterans.
Shortly after I went into the Navy in January, they ended the Vietnam War and the draft, and I spent my entire time in San Diego and Pearl Harbor, on board ship at Pearl Harbor. I would like to see the politicians fully fund what is needed. We've got a lot of veterans from the Iraq and Afghan war that need a lot of help, physically and mentally. And they put their life on the line, and I think the taxpayers should pony up for the service that they have done. And I think that's been some of the problems in the recent months with the VA, is that there just weren't enough doctors and personnel to take care of everybody. And if it's funded, it runs smoothly. And I think they do a great job. It's quality care, and they're efficient, which in the corporate healthcare world is not always the case. I think the quality is excellent. The Sioux Falls VA does a very nice job. The people down there are wonderful. The volunteers that direct you where to go, all the way to the doctors treating patients and everybody in between. They all do a great job, and the nurses do a really good job also. they're busy down there, and once in a while I have to park on the outer edges of the parking lot, and there are words on the side of the building in big letters, "The price of freedom is visible here," and it's so true. There's a lot of people that really need help down there.
Well, we've got a bunch of questions. We appreciate your questions, and we ask you again to call 1-888-376-6225 or ask at oncalltv.org. So we've got a bunch of questions.
Great.
I've got two people asking about dental care. Why do we not have dental care, or why would we not, why are some not eligible?
That is a question I get a lot too as a primary care provider. As far as I understand it, you have to be 100% service connected
to get dental
care. So that means that you are 100% disabled, related to your service work or your service in the military, and then you can get dental. There are a few exceptions if you have certain types of cancer of the mouth, or you need your teeth fixed for another reason. We do make exceptions to that rule.
Right, and it's just a matter of how much money you have and how much you can afford, and there's certain things you can do, but there's certain things you can't.
Right. Yeah. Correct.
But I would only say that when the teeth are bad, it carries a big health problem to a person.
Absolutely.
Mike, any comment about national discussions on dental care?
I would say that Congress sets the rules, and the eligibility about who gets what and how much they get. And the eligibility for dental is relatively narrow, and it's complicated. So you have to almost go to the dental office and talk to them about it to know who's eligible and who's not. But Carrie's right. I mean, if you have the dental illness that's so bad that it's affecting your medical problems, you can be eligible for dental care. But I did want to say that there is a program, I understand, of dental insurance. It's a pilot program that allows eligible veterans to buy dental insurance for the next couple of years. And so if you're interested in dental care, you might check into that.
So it's through the VA. It's a dental
Through the
insurance
VA.
through the VA. So we have a question about, caller wants to thank the VA for great care that was provided to her husband. So we like to hear those. We'll take all comments. Criticisms too. Here's one from Custer. I've heard that the VA doctors don't have the same rules, that you don't have the same boards or you don't have the same requirements as other people practicing in the state. Is there any difference?
No, there's no difference. You have to be board certified in your respective specialty, whether that's internal medicine, family practice, whether you're a specialty doctor like cardiology, endocrinology, pulmonology. No, the credentialing is the same.
All right. Anything different in other states, Mike?
Well, the VA is a national system, so as long as you're licensed in one state, you can practice in the VA. And sometimes people think that, that confuses people about, are the rules different? But no, Carrie's right. They're very strict rules. I mean, there has been, as you can imagine, problems. And so in the past, the VA has probably one of the best credentialing systems around. They go to the root of every one of your licenses and credentials to make sure that they're all in line.
So I've got a question about why can't I make an appointment to see the specialist? Now you talked about cardiologists and so on and so forth. Sure. Doesn't the VA have specialists? Don't you? You don't have cardiologists, but you sublet a cardiologist or something.
Yes, we do. We have a cardiologist that comes from Sanford, and he's there pretty much every day. And I think he might be a VA employee now. I'm not quite certain. But in order to get a specialty appointment, you need to go through your primary care team. So your provider, your medical provider, needs to put in a consult in our computerized electronic medical record. The reason why, but it's fairly straightforward. If you ask, and there's a reasonable.
And here's the issue. I think a lot of people think that the primary care guy's been or gal has been jumped over, and people go directly to their endocrinologist. If they've got a little bit of a blood sugar, they go right to the pulmonologist because they've been short of breath. And really, that's the most expensive and probably not the very best care, because there's a lot of reasons, for example, you could have shortness of breath.
Correct.
So I don't have any problem, the VA starting with the primary care person
Right.
and going from there if it's appropriate. Mike, any comment about that?
You know, the VA has a great primary care system, and we may get a chance to talk about the medical home later, but, you know, there's team-based care. We hook up people not only with the provider, with the doctor, but also with their team, which is wonderful support. And there's access to, the VA either provides or buys or transfers or gets you access to whatever kind of specialist is needed. There's fabulous prosthetics, there's fabulous transplant services. You know, you can, you know, VA is associated with, I believe, about 110 of the 130 medical schools. So there's great knowledgeable physicians in the system. So if you don't get it at your place or at your CBOC that you're at, that doesn't mean it's not available. You know, it's a system that you can get just about anything that there is.
Well, and that it lends itself to the question about places that they don't have access. People say that it's a long ways to go to get care in Sioux Falls or Rapid City, and I know I'm seeing in that map that there's a lot of other places. But there's been some suggestion that and a move that people can go to primary care doctors and they can be paid by the VA system. Where are we at with that?
Well, they just rolled out the choice cards, and Mike is, I'm sure, familiar with that. And so, what if you live right now? If you live more than 40 miles away from your local VA, then you can call. You get this card in the mail from the VA, and they're mailing them out as we speak, and you can call and see if your personal doctor, like someone seeing you, can see you through this choice card. Otherwise, we work very hard to try to get a DAV van to your area to bring you to Sioux Falls if you don't have transportation.
All right. And I have to say that that brings me to the message that I have a number of patients that you also have, that they use the VA benefit of primary care, and then they also see me, and they kind of play us off each other, which is all right with me.
Yeah, me
They
too.
can get some
Great.
testing that's cheaper at the VA, they can get some meds that are cheaper, and then they can come to me and they say, what do you think
Yeah.
about what we should be doing here?
Is she doing the right thing?
Yeah, so that there's that, and it goes both ways. you know.
Right. Yeah.
So-
No, they love you.
I think that there is that particular comment about people going everywhere. Mike, do you have any response to that particular?
Yeah, I mean, there's a great freedom in this country that people can go anywhere they want by episode of care. And so, you know, people can use their Medicare benefits, they can use their VA benefits. Heck, you can use your Department of Defense benefits, your Indian Health Service benefits. I mean, some people buy care privately. And, you know, the good thing about that is there's lots of choice. I mean, I think the difficulty sometimes can be the fragmentation and trying to put together the story about who's doing what where. So we try and encourage people to get a primary care doctor, stick with that one person, and then use them to help manage, you know, the specialists that you see in your care so that things are coordinated.
That whole thing about the medical home is a really important issue, and that's what he's talking about, and that's what I think the whole world, well, the whole country is going to go toward.
Absolutely, and that's the safest thing for patients is they need to focus on, you know, a facility to help coordinate their care and then share that co-managed care with your clinic.
So many people don't have a doctor.
Right.
I mean, everybody should have a doctor or a nurse practitioner, PA, or care provider. That's mine. And that person's watching out after you, and they can get you to somebody if they need. So we have one question about Hot Springs VA being closed. You have any comment about Hot Springs?
I've never honestly been there. I hear it's a great facility. I hope they don't close it. I hate to see it close. It sounds like it has some really wonderful programs there. Mike?
Maybe you know more about Hot
Well,
Springs.
you know, I was the chief of staff out there for many years, and I think the comment is a little bit of a rumor, urban myth, right? And we're trying to squash these urban myths. There is a proposal for change at Hot Springs, but the proposal is not to close Hot Springs. The proposal is to make it a CBOC, a community-based outpatient clinic, kind of a super clinic, if you will, and then move the domiciliary, the rehab, to Rapid City, where there's more access to jobs and a bigger population. That's the proposal. But it's a beautiful facility. I mean, there's great, wonderful historic buildings. There's a very caring, VA employees there that feel deeply about the mission. And so it's been a painful issue for some.
Right. So I have one that talks about saying that we should have Fort Meade open during the Sturgis bike rally. What do you think of that, Mike?
Actually, it is. There's a lot of local people who don't want to navigate the traffic to come in and keep their appointments, but there's a CAT scanner there, there's surgery there, there's emergency room. It's open during the rally, and we definitely get some interesting characters.
Yeah, and I suppose, and a number of those bikers are vets. I'm sure they are.
Yeah.
Both husband and wife are veterans. They received private care for many years through their respective employer. As they reach retirement age, they'd like to establish care through the VA and have been told they cannot change over to the VA. Is this true? And how can they establish VA care if they want to?
Oh, I don't think that that's true per se. No, I don't know their individual situation and the details.
I mean, they were vets.
Yeah, I don't know if they went through the eligibility office at the VA, and you can do that online, or you could just stop into the local VA and talk to the eligibility office, and you have to show some documentation, some financial documentation, your service discharge papers, I believe. I don't know the specifics more than that.
Yeah, you can even go in, and apply online and fill out that 1010EZ form that it shows on the screen there. Or you can call the phone number, 1-877-222-VETS, and apply to the VA there. But we really encourage people to go in online. That's a really fast and efficient way to apply.
And if those people who can't see some people's TVs didn't show the whole number, what would be the online place to go?
You'd go, so I know this. So it's it's www, so World Wide Web, right? That's the .va.gov. If you go there, you can get access to a wealth of information about the VA, including how to apply, what the health benefits are. And there's not only health benefits, right? There's cemeteries, there's disability benefits, there's insurance. There's educational loans, home loans. Like I said, VA has a broader social mission too.
I have one vet who is asking, I want to be buried in the VA cemetery, but I'm told that there may be no room left. And so what can he do, or where can he go, or how does he find out about that? Do you know anything about that, Carrie?
I'm sorry, I don't know anything about that.
Well, the Black Hills, when you drive between Rapid City and Sturgis, it has a wonderful national cemetery that's, you can't miss. It's emotional, really, every time I go by it. There's plenty of room there. Actually, room is not a problem. They've even acquired more land. They're developing more land. So if you want to be buried there, which is a beautiful place, which I would love to, if I was eligible, which I'm not, even though I've served veterans for 30 years, it's there.
Okay. I've got a question. The Spokane VA closing their emergency room in December. What happens to all their patients, and is that the plan in South Dakota?
We're not closing. Spokane, Washington?
Yeah, Spokane. Spokane VA. I suppose that must be Spokane, Washington.
Okay. Our VA is strong, and our ER is busier than ever. So we're not closing anything. We're expanding, and we're hoping to expand our ER.
So now the ER, you're talking about a full emergency room.
Correct. We have ER-trained physicians, several of them, and it's fully trained. Yeah, fully functional.
So is it only for vets, or I suppose they can't turn anybody away, can they?
We can't turn anybody away. So we have injured employees that will code, so to speak. We had one the other day, and so we're helping the injured employee as well, but otherwise veterans and employees, correct.
So I'm going to ask that waiting question again. What data do we have nationally, Mike, about waiting, and what are we doing to change that?
So after the sort of access crisis, and people rightfully so got focused on waiting times, I mean, there was a couple of things that happened. One thing was that VA started publicly reporting their waiting time data in a very detailed manner. So you can go online. Now, you could Google this, right? You can go online and you can get the waiting time statistics for your hospital, your clinic, your part of the country. And it's a fabulous commitment to transparency, not only in reporting waiting times, but also in quality data in the hospital and, outpatient quality data. So you can go on there to see the waiting times.
Okay, so once again, go to the VA site. Here is a caller from Fort Thompson who said that why can't a patient go to Sioux Falls for care? Must I go to Fort Meade? Was very frustrated about the clinic he needed to use and how to get that travel paid for. So he's in Fort Thompson, he's halfway in between, and he was told that he needs to go to Fort Meade instead of Sioux Falls.
I'm going to defer that to Mike, since you're an access guru.
Right. How do you switch access if you want?
Well, one of the great benefits that the VA has is that it actually pays gas money. So for people who can't get there, it pays travel. And, like anything, there are rules around what they'll pay for and what they won't pay for. But, the important point to know is you can go to any place that you want to go. The travel pay rules you may get only paid to go to the closest place. I believe that's how it works, actually. But you're completely free to choose any site of care that you want to go to.
Yeah, and I can understand why they wouldn't let me go to the VA in Florida. I was kind of wanting to get my care there, and why wouldn't you pay for the travel?
You should get paid. No,
Yes,
I'm just joking.
that was a joke.
But I think this patient who's frustrated with this situation, he should maybe call the Sioux Falls patient advocate, the VA patient advocate phone number, Beth, and then she hopefully won't be mad at me for giving her information out. But if they're frustrated, they should call and talk to someone who can help them navigate those frustrations.
Okay. One area in which the VA leads the way is in orthotics and prosthetics. Currently, there are 178 medical facilities and 63 prosthetic labs serving our veterans. The newest lab is to open in Sioux Falls early next year.
Orthotics is the bracing of the human body, and prosthetics is the artificial limb. Prosthetics, they're losing a part of their body, and that's why when we say the grief and loss stage, it's like going through a death or a divorce. You have to come to the self-realization, hey, this is going to happen, it's going to change my life. But with the technology today, again, we're looking at restoring them to a basic level of functioning for everyday living, to be able to get out of bed, go to the kitchen sink, go to the car, to be able to walk to the wall, those types of things. Most of your research has come out of the VA. After World War II, World War I, Vietnam, Korea, the research, the technology evolves. Today we have microprocessor knees and prosthetics, which is the higher tech, the higher end componentry. Makes life a lot easier for a lot of the amputees. Technology is a good thing, and the VA is at the leader, they're at the forefront of that. Individual cast is taken of the person, and then we pour plaster in that cast and modify it and pull what we call a check socket just to do it's clear plastic to do a visual fitting. We'll do what we call a static and dynamic alignment. In other words, they'll just be standing just to make sure there's total contact, and then we can walk them. Our field, our numbers are getting smaller as far as people entering the field in the private sector and in government as well. A lot of us are over retirement age. Orthotics and prosthetics is a great field to go into. I love it. I feel like I've made a difference at the end of the day. I've never had a negative day in all the years I've been doing this. I feel good about what I do, and I feel like I've given back to my country.
Thank you for that very interesting discussion about orthotics and prosthetics. So, and the amazing bit of information that was on the line that 90% are not related to war injury type of a thing. Explain that.
Correct. Well, we have a very high population of diabetes. In fact, we just had a recent podiatrist who was at a meeting today. He was retired from another facility and came over to us, and he is shocked at how many diabetics we have. And so I think that plays a large role in their amputations.
Yeah, when a person doesn't feel their foot, they can walk on a pebble all day long. There's a hole there, and it gets infected, and blood flow is not great.
Correct. And we also have a high population of veterans that have peripheral vascular disease, arterial vascular disease, and a lot of smoking. So that plays a big role in the vascular issues that lead to amputations.
A lot of people blame, I remember World War II. I mean, my dad was a smoker, and the World War II story was that almost 90% of those guys came back from World War II smoking because they gave free cigarettes.
They gave out them rations. They gave out cartons.
Yeah. Do you sense that smoking is a big problem?
I think it's a very large problem, and I think my dad was a Vietnam veteran, and they used to hand out several. I think you got 2 packs of cigarettes every time they handed those out, so everybody just smoked.
We have a graph. The blue is the veteran. The lighter blue is the dark blue is the veteran. The lighter blue is the non-veteran, and it shows a higher percentage of smoking in the veteran, although I sense that it was a bigger deal than that.
I think if my panel of patients and you were to look at how many of them were smokers, because you asked that question by email today, and I was thinking, I think it's 60% out of maybe 800 people, I think. But
60%.
It's a lot.
So this is the Great American Smokeout Day. What would you say to the people watching about smoking?
Smoking is really a bad idea, and I know it's really hard to quit, but there's so many great options and ways to help you quit, and you just need to ask your provider. There's medications, there's pills, there's patches, there's gum, all kinds of things.
And there's plenty of reason to make a decision to quit.
And the VA, if I may, the VA has a great system to help veterans quit smoking. And we ask patients when they come in for appointments in primary care every time if they are interested in quitting. If they are, then we can give them information. We have a pharmacy team that can help them too, not just the
bupropion or the Chantix or any of those things you'll give them.
We offer all those things, and we offer them to our employees as well.
Yeah.
And when I started practice, just about everybody in my panel smoked, is what it seemed like. And then when VA started this, prevention and chronic disease care and started measuring how many times did we really ask patients to stop smoking, offer them, a way to stop smoking, I was amazed. There were people in my that visited my clinic who swore up and down that they would never quit. But after trying some of this stuff, today I have almost nobody on my panel of patients that smokes anymore. It's been an amazing transformation just in my career, and I never would have predicted that. So I think really what care we provide in the clinic in terms of planting the seed, asking people to think about it, and then helping them quit really makes a good difference.
So it amazes me, Mike, that you, the leader of outpatient care, Washington, national leader, you're living in South Dakota, and you still have patients that you take care of. Tell me a little bit more about that.
Well, after going to medical school and residency and, dreaming about being able to take care of people's healthcare needs, it's hard to leave that. It is the most positive feedback that I get in my day, of anything I do. Certainly the administrative jobs are very different than the direct hands-on patient care. I really enjoy it. I love my patients, and I know we have a great relationship. Some of these that have expanded, since the days of my residency. I have a patient from Falkton who drives clear over to. I have another one from Lake Andes who drives out, makes the trip to Rapid City, and it's just been a joy to be involved with patients over time.
I mean, that's the reason why doctors work very hard, because it's great. It's a job that is very, very rewarding.
What loyalty they have to you. That's pretty great, Mike.
Yeah. You've
Yeah.
got those too, though, don't you?
Yeah, I have a few.
2 years
Yeah.
in this. So, and have you noticed any smokers that have quit smoking since you've been haranguing and harassing?
Well, today, a few, yes. I try not to lecture too much because you can kind of tell when you start lecturing to patients
They
that
go,
they kind of shut down, and I don't
Yeah.
want to. I want to have that kind of conversation with them all the time. So.
But one conversation I commonly will have is, you're still smoking? Yes. So how do you want me to approach this? Should I give you a haranguing and jump all over you, and do you want me to do that? Yeah, go ahead and do it. They'll tell me that.
Yeah.
Some of them say,
Yeah.
no,
Nope.
enough,
Yep.
done.
Not quitting.
So from Mulbridge, why do patients see nurses only instead of doctors at the VA? I used to see a doctor. See, some are seeing nurse practitioners or
Right.
PAs. What about that?
The Mobridge site, I'm not familiar with. Mike, do you want to comment on
Mike,
that?
Well, I would say that, the VA has physicians and then is blessed by nurse practitioners and physicians' assistants that really provide primary care. In addition, the primary care providers, we've gone to this word providers now, because there are some doctors and some physician assistant and nurse practitioner. But those providers have support from nursing staff. So sometimes, patients will see the nurse first. And I have to say that in my judgment, those nurses are really responsible for VA's tremendous quality of care because they're the ones that spend really a lot of time with patients up front, asking them questions, probing, screening for PTSD, for example, and smoking and diabetes and heart disease, to make sure that we're covering all the bases. And so patients spend a lot of time with nurses before they even see the provider.
Yeah, and by the way, the same story in my practice. I mean, the nurse practitioner works with me. She's wonderful, and when there's a problem, she's got me on the line.
They're great. I work with a lot of nurse practitioners and PAs as well, and some of them have been at our VA for over 20 years. They're excellent.
So there's a crisis line. What is this about? Do you see online that we got something right there? Let's see.
Yes,
right
the crisis
there. What
line.
is the crisis line?
So the crisis line would be, I think, mainly geared towards an acute mental illness, PTSD, acute depression, suicide attempt. That would be
the number
to call.
Let's talk about PTSD.
Yeah.
Explain it, and is it an issue for the VA?
PTSD is really, you can't see it. You can't look at someone and go, look, Rick has PTSD. It's not always noticeable. It can be very hidden. It's a very common diagnosis. A lot of veterans don't want to talk about it. They don't even want to acknowledge it. So it's more of asking the right questions and finding out how they're doing. And we have a whole team of mental health that pursues that.
Right. Mike, how would you diagnose PTSD?
Well, it first happens in the VA since it's so common, right? 30% of those veterans that came back from Iraq and Afghanistan have PTSD, we figure. And so it's a screening question. When you come into the VA, there are screening questions about PTSD. But of course, there's things that can be mixed up with acute anxiety disorders, for example. And so the PTSD team, usually we have experts that deal with this really every day, takes over at that point. And they make a diagnosis, and then they look at a range of treatment options. I mean, it's very treatable nowadays compared to the old days.
Right. I mean, the picture I have is the vet who is the gentleman in the Army who is driving the deal. A little kid comes out in front of him, and it threatens. He's involved with that, and then there's a bomb. And so now he's done. Maybe he's had an amputation because of that bomb, or maybe he's just home now. And there's kids walking on the street in front of him, and he panics, and he just sweats, and his adrenaline kicks in. Is that the picture?
Flashbacks. There are veterans that have trouble with those and nightmares, and certainly we try to get them mental health. Maybe it's medications to help lower the frequency of things like that. We certainly want to find out their ability to function. Is this a daily occurrence? Are they not being able to hold down a job? This is a really common problem with our Iraq and Afghanistan veterans coming back, and it's something that we have to really continue to work well on.
Yeah, I think sights and sounds and smells, can set it off. I've had a patient, actually a friend, who went to the military and then came back, and he was sitting at the kitchen table, when a car went by and backfired, and he was under the table just like that. I've had a couple of patients that I've taken care of who sleep with a gun under their pillow. They're scared. They've got thoughts going through their mind, and that pathway of fear is just worn and so common that people just go back to that war experience and think about that all the time, even when they're back home.
So the treatments that we have, I know one treatment is a beta blocker. It takes away the adrenaline kick that just all of a sudden they're just overwhelmed by adrenaline. But there's other things, right?
Yeah.
Like what?
Well, there's certain psychiatric medications, and as a primary care physician, I actually don't prescribe those. Those have to be prescribed by our psychiatry staff. But there's other different medications like SSRIs, like Prozac, Wellbutrin. There's things to help them sleep. A lot of them can't sleep at night. So Ambien and some things if needed.
Let me roll through some questions. Discuss mandatory funded versus fully funded for the VA. What is that? Do you know?
Mandatory funded.
We're going to throw it at Mike.
That would be
That's
Congress.
a Mike thing.
That's a Congress question.
Yeah,
That's a
Congress
Washington question.
Congress really provides the VA budget, and it's part of the federal government that's called discretionary funding, meaning that they have to vote on it regularly and decide how much money to fund for the VA. So in the past, it's been 1 year at a time. So everybody kind of sits on the edge of their chair waiting for the budget to see how much care we can provide, how many, clinics we can open or, have to shrink, from year to year. Now, recently they've gone to 2-year budgets, which is better. But there's a group of people in the country that say, this is a benefit that we're going to take care of our veterans no matter what. It should be a mandatory part of our budget that,
Right.
We guarantee the funding is there.
They did this. They went to war for us. They put their life on the line. For gosh sake, shouldn't we take care of them?
Yeah.
Sioux Falls, also on Medicare, how is payment handled between Medicare and the VA? Is one secondary to another? Do you know that?
That's a common question. I think if you're getting your care at the VA, then your bill depends upon your service-connected disability. So, for example, I saw a new patient to the VA a few days ago, and his bill, because he's not yet service-connected for a disability, his bill to see me will be $15 for 2 hours of care. But the Medicare piece, I don't know. I don't know if they can bill on top of that. I'm not sure.
Okay. And here's
VA can bill insurance companies, right, but not Medicare.
Okay.
And so there's this sort of one or the other, so it's not double funded.
depending upon what it is, but not double. Here's a caller that says, patient of Dr. Carlson and wants to send her highest praise to you.
Aww.
He is very pleased with the quality of his care.
Oh, thank you.
Nobody's calling about Mike though. I've looked through these and no, sorry. Regarding husband and VA system on Medicare, not on Social Security, still working. Why can't he qualify for VA benefits? They say he is over income.
Oh, there are some rules with the income, and I don't know those specifically because I do think that changes over time.
Okay. And ask your VA. Go to the internet and
eligibility. That's
eligibility
the eligibility
issues.
Yep.
And it's complex.
I wish it wasn't.
Take home, 15 seconds, take home message.
Take home message. The South Dakota systems and the systems with the VA in Sioux Falls anyway that I'm familiar with, we all try to work really hard to take great care of our veterans and serve them and their needs.
And Mike, take home message?
People who work at the VA do it because of the mission. They care about our heroes, our South Dakota heroes, really. And so it's a great place to come and get your care.
We'll be right back after this.
I found a better deal on prescriptions.
New plan, same doctor. I'm happy.
It's Medicare open enrollment. Have you compared plans yet?
The online tools make it easier.
Well, you can just call.
You'll never know unless you go. Quit smoking, and in just 20 minutes, your blood pressure returns to normal.
In 12 hours, carbon monoxide levels in your blood drop. In 48 hours, your sense of smell and taste improve. Within 2 weeks, your lungs work better, you heal faster. 9 months means more energy, fewer illnesses. And in 5 years, your risk of heart attack is half of what it is now. Take a deep breath. You can do this.
My father was a World War II veteran, and I know the experience of being in that war left a huge mark on him. Many of the disciplinary methods he used on my sister and me were a direct result of his U.S. Army training, such as his "no excuse, sir" type of stuff. I know he felt a great bond with any other veteran of any war, even when meeting them for the first time. But his service was not without some bad consequences. I remember how he turned serious and silent when I asked him the awful question all kids wonder about their warrior fathers. "Did you ever kill anybody, Dad?" I never got an answer, and years later I've realized the question caused significant anguish. I know many people put in harm's way having to fight to survive share this kind of struggle. I believe it represents at least one level of what is now called post-traumatic stress disorder, or PTSD. Personally, I struggle sending our young adults to fight against other young adults who are also sent to fight for some political reason. That debate must be left for another time and for better minds than mine. But I do not struggle with our government doing its level best to medically help those who are harmed by armed conflict. And I believe we do just that with our U.S. Department of Veterans Affairs, or the VA. In recent years, battlefield medical units have been so much more effective in bringing those injured through the acute trauma of war that many more severely injured soldiers now survive when they would not have in times past. This is a remarkable accomplishment, and yet such survival has resulted in many more veterans who are severely disabled from physical and mental trauma. Now these wounded soldiers are back home doing their best to cope and function in our society. To help these injured return to function has indeed been the evolving direction of the modern VA. For example, the VA has been on the cutting edge for research and development of prosthetic limbs. This work will also benefit others needing prostheses, no matter what the cause. Of equal importance is the VA's evolving work for those suffering from other severe injuries, to include PTSD. We have no excuse, sir. Our responsibility as a government and a society should be for veterans, to care for them, to understand them, to hire them. Thank you to all who have served our country, and thank you, VA. This brings us to the end of our show this evening. I sincerely thank our fantastic guests tonight, Dr. Carrie Carlson from Washington, D.C., Dr. Mike Davies. Today was the Great American Smokeout, begun in the 70s. This event is aimed at giving smokers an opportunity to stop for at least one day. If you did, then congratulations. Now just make it 2 and a row, and then 3, and then, well, you get the idea. On Call with the Prairie Doc will not be here the next 2 Thursdays, as it's Thanksgiving on the 27th. So take time to enjoy your family and friends. Have some turkey, watch football, maybe nap on the couch. Be thankful. And then on Thursday, December 4th, South Dakota Public Broadcasting will have some special programming for their Friends Membership Drive. Be sure to tune in and support this wonderful asset we have here in South Dakota. We'll be back live on Thursday, December 11th, when we tackle the important questions of end-of-life care. Please join us then for this meaningful and far-reaching conversation. As often happens on the show, time ran out and we did not get all of your great questions. So to hear your answers, our answers to more of these questions, please join us now on our website, oncalltv.org. where we will continue live with On Call After Hours on the web just in a few minutes. As musician and poet Bob Dylan said, how many times must the cannonballs fly before they're forever banned? The answer, my friend, is blowing in the wind. The answer is blowing in the wind. And until next time, get a flu shot if you haven't already, and stay healthy out there, people. There.
It is something we'd rather not think of, but with today's medical possibilities, more of us need to balance our values, beliefs, abilities, finances, and family wishes when we consider end-of-life care. Next time, On Call with the Prairie Doc.
Hello and welcome to On Call After Hours, where we answer the questions we weren't able to get to during the broadcast portion of our show. All of your questions are important to us, so we want to answer as many as we can for you. So let's start, and we'll throw them back and forth. Here's from Sioux Falls, a 60-year-old person. Wasn't the VA the first to use electronic medical records?
It is very astute, yes. In 1997, I believe, we came up with our CPRS, Computerized Patient Record System, and it's good.
And some
Excellent.
people say that everybody should have fallen suit and just gotten free. It was available for free.
There you go.
So why didn't we do that, Mike?
You know, it would have been a great idea, because then we would have solved the problem of how to communicate with each other. And, you know, that system was really built by the people who used it, which is the reason that it got quickly known as the best medical record system out there, because there was so much feedback from the users. It served the patient's needs.
Yeah, and unfortunately, the people who made the medical record I'm using are not practicing. I'm sure they're not. I mean, you know, let's not get started, but I'm proud of the VA. My husband received a letter on October 9th, 2014 to make a follow-up appointment with his primary doctor at VA Hot Springs. The soonest appointment he could make was December 22nd, which is, by the way, I might say about the length of time or quicker than they can get in to see me. He does have good care there, but never has been able to get an appointment in a week, and has at times ended up in the emergency clinic.
That's a bummer. I don't know. I don't know their staffing.
What they do in my clinic is they have a walk-in clinic open at all time. Do you not have a walk-in clinic open at all time?
We don't in Sioux Falls have a walk-in clinic at this time. We have, of course, the emergency room for appropriate emergencies, but we really just communicate with your primary care team. Maybe he just needs a phone appointment. Maybe he needs an appointment with a nurse, a registered nurse, because they are very well trained and they do a lot of case management. And there's other ways to get appointments. You can have an appointment with a pharmacist, maybe if it's for diabetes meds or your Coumadin adjustment.
Okay. Mike, any comments?
Yeah, you can also do email communication with your docs now. We've got this secure messaging, component. So if you're computer savvy at all, just get online and communicate that way. You can do telemedicine appointments. There's a really cool technology that VA will come and put in your home, and you can communicate with your provider team that way without having to even travel. So there's other options.
How do they get started on that?
Well, they come in and talk to their primary care provider. There's a telehealth nurse at most VA facilities that will set them up for what they need. Sometimes it's as simple as, push the button when you take your medicine, if it's a critical medicine. And then we have a nurse at the VA who watches the computer and sees, 150 people who are supposed to take their medicines. And if somebody doesn't, then we call them and try and get to them before they come to the emergency room.
Compliance.
So there's lots of options.
Yeah. Lots of options.
Watertown, South Dakota, why not just give veterans a special card to allow them to go wherever they would like in the private care world?
Well, there is this card that's coming out that if you need to access care sooner than 30 days or
Whatever it is.
whatever it is, I can't answer that. That's a financial piece, and it's
Another story.
It's another story.
You're involved with blood pressure and
yes.
heart trouble, not the payment
Yeah, I'm
part.
not an administrator.
But Mike might answer.
Well, I think the U.S. is keeping the promise to our soldiers' sons and daughters and fathers and uncles and grandmothers, in some cases that, we'll take care of them. And I think the VA system is the realization of that. The best studies that have been done on the finance that I know of, and it's hard to do studies because people use the VA and non-VA systems, say the VA is cheaper. And we know that the quality of care in the VA is better in general than the private sector. And people might be surprised to know that the patient satisfaction in the VA is higher than in the private sector consistently for the last 10 years.
Wow.
It is very good.
Rapid City 71. Why have I had to pay $50 for my annual physical at the VA when I go to the primary care doc? Medicare would pay for it. What's happened to me? Twice, he says, that's happened.
If it's $50, he might be seeing a specialist because there's some different rules with the money. But if you, let's say he had an appointment with his cardiologist, he had labs, he saw his primary care team, and he saw maybe physical therapist or had an x-ray, that all is $50 as far as I understand it.
Okay. All right. Any comments, Mike?
No, I think Carrie nailed it. That's right.
Rapid City, husband in the VA, in a VA home, but couldn't get medicine for husband in Hot Springs, had to move him to Rapid City. Hot Springs wouldn't recognize the VA medicine, VA homes fill. I'm not quite understand, but it had to do with VA medicine and had to move to Rapid City instead of the Hot Springs nursing home.
Yeah, I could take a crack at that. When a person is in a nursing home, usually the payer of that nursing home pays for the medicine.
Sure.
And so rather than double supply the patient with medicine, you usually try and go with one source or the other. So it might be that situation the questioner is referring to.
Okay. And had to go to the VA nursing home.
Right, and that could be a question. Like my nurses that I work with directly, they could help navigate some of that, or they would know the people to call if I got that question.
I know that the VA employs the Arlington Golden Living Center nursing home that I'm the medical director for.
Yes.
And that's a great nursing home.
Yeah.
I like the nursing homes in my town, and I also like the Arlington nursing home. And but the VA has employed the Arlington nursing home to take care of some of their patients.
That's great.
Here's a question from Rapid City, and it may not have anything to do with the VA, but it's our last question. Melanoma in the eye, cannot see radioactive plaque close to optic nerve. How long does it take for the fluid to go down? Is it helping? What is it causing it? Does the VA help with this kind of treatment? So the person has melanoma of the eye and is going to be getting radioactive care.
They're from Rapid.
Rapid City.
They need to contact their primary care team and maybe ask some of those questions to them that can then ask, I don't know if it would be the ophthalmologist or they might need to go to another bigger facility like Denver, the Denver VA.
But the VA will help him
absolutely.
with this
Absolutely.
situation.
Cancer, we do lots of cancer care, and we're expanding our cancer department.
Do you have radiation therapy in the VA?
Not at this time that I'm aware of in Sioux Falls.
In Sioux Falls.
Right.
Okay. So, Mike, any take-home messages?
I think the take-home message for me is that the VA will either directly provide or get you what you need. We do our best to do it close to home. And so in my time in the VA, we've purchased more and more of this care with our community partners and providers. So in that question about the melanoma of the eye, I think we would refer to Rapid City. That's close to home, find a specialist, get them there, and get them treated. VA will get you what you need. It's just a matter of asking.
Absolutely.
Any take-home, Carrie?
No, I'm honored to be here. I'm honored to serve our veterans. I love caring for them. It gives me a lot of pride to be a part of their life and help them through their times of health and disease.
Well, I thank you, and I thank you too, Mike, and thank you all for joining us on our website for the after hours portion of our program. We appreciate all of your questions and the opportunity to answer them. Remember, we'll not be here the next 2 Thursdays, as it is Thanksgiving on the 27th, and on the 4th, South Dakota Public Broadcasting will be having their membership drive programming. But be sure to watch for Prairie Doc Perspective column in your local newspaper, listen to our Prairie Doc Conversations radio show on a station near you, and follow us on Facebook, Twitter, and Pinterest. And until next time, stay healthy out there, people.
Funding for On Call with the Prairie Doc is provided in part by
Avera is a proud sponsor of On Call on South Dakota Public Broadcasting.
Larson Manufacturing is proud to support On Call Television as it continues to open doors for important medical information.
and by the South Dakota Foundation for Medical Care, the Medical Care Quality Improvement Organization for South Dakota. Additional funding is provided by Aberdeen Asthma and Allergy, Brookings Health System, Dr. Mark Bubach with Dakota Allergy and Asthma, Dakota Care, Dakota Dermatology, the Orthopedic Institute, Physicians Care Sanford Clinic Community Service Committee, and Swiftel Communications. Closed captioning for our On Call with Prairie Doc is provided by generous support of Avera, Brookings Health System, and Fishbeck Financial Corporation.